Thank you so much for arranging this platform for us. It's a wonderful platform to give career guidance and career counseling for all of our students. And just I would like to remind all our students one thing is that we are conducting these career counseling and residency counseling sessions every 2 months. And we are coming up with a new topic or at least a new content every 2 months. I would like to ask and request all our students who are in basic sciences and also in the clinical rotations to use these residency counseling sessions. And it's very important, and it's very what you call career driven webinars. And I wish I wish all of our students would like to use these career counseling sessions. Please do not miss any of these, because the speakers, most of the times we will have Dr. Gani, who is our Associate Dean of Postgraduate Education. Sometimes we will have Dr. Wilson, who is Dean of Clinical Sciences. And also we will have sometimes Avalon graduates who already graduated from Avalon and who are doing residency currently. These are the different speakers who can be part of these career counseling sessions. Sometimes we see very good attendance for these career counseling sessions, but sometimes we are observing that with very less attendance. And this is the time I feel like, as a dean of the school, I would like to remind and ask and request all of our students to use these sessions. The reason is, by the time you come to 4th year or by the time you come to 3rd year, if you're looking for counseling sessions or residency counseling, and if you start preparing at that time, it will be too late. It's better to start from the beginning. That's why I'm requesting you to start from the beginning, attending these career counseling sessions. And just I would like to introduce myself. My name is Sateesh Arja, and I'm working for Clinical Skills Department and Medical Education Department at Avalon University School of Medicine. And I will be talking today about what you call virtual residency interviews. My main focus is on virtual residency interviews. Even though my main focus is on virtual residency interviews, I will also speaking about USMLE Step 1 preparation and Step 2 preparation also a little bit. Please, next slide, please. So what changes have been done recently for USMLE Step 1? One of the biggest changes that happened to USMLE Step 1 is that there is no more numerical score. It will be only pass-fail, which is effective from January 26, 2022. From that day onwards, you don't see any numerical score or 3-digit score. It will be only pass-fail. Anybody who is taking USMLE Step 1 from January 26. The last date you receive 3-digit score is January 25th, 2022. So what is going to happen to me if there is no numerical score? And why the USMLE and ECFME has done this? The reason why USMLE and ECFME has done this, because of what you call, they thought that medical students, while they are in 1st year and 2nd year, they are focusing too much on USMLE Step 1. They are stressed out, and it is causing burnout among medical students. That's what they thought. And because of that, they have decided, they discussed with all the stakeholders, including medical educators across US, and finally they decided to take away this 3-digit score. And what will happen to me as a student if there is no 3-digit score? Nothing changes, but what will happen, I can say that what you call, the program directors will be looking at USMLE Step 2 CK score, because they need some psychometrics or some numerical number to evaluate the medical students, and to filter the residency applicants, they need some score. So instead of using USMLE Step 1 score, most probably they will be using Step 2 CK score. And the reason why USMLE and ECFME have taken out this score, the USMLE Step 1, because they thought that medical students are stressed out. But now what happens to the students is, they will be focusing more on Step 2 CK score while doing clinical rotations. But being a future physician, being a what you call, if you want to be a better physician, you need not only focusing on USMLE Step 2 CK score, but you should be focusing more on the patient care. I hope you don't neglect patient care while doing clinical rotations, focusing on Step 2 CK. And not only the Step 2 CK score, but the program directors will be focusing more also on letters of recommendation. We will speak about letters of recommendation in the coming slides, but I would like to let you know that letters of recommendation play an important role, not only in the future, but even now also. And you need to have at least 3 or 4 letters of recommendation, but out of those 3 or 4 letters of recommendations, 2 must be from the specialty of your choice, and 1 or 2 can be from the subspecialty. Suppose, for example, If I'm interested in internal medicine, I should get 2 letters of recommendation from internal medicine. Maybe 1 or 2 letters of recommendation can be coming from what you call the subspecialty of internal medicine, maybe from neurology or maybe from cardiology. You can take like that. Suppose, for example, if a student is interested in what you call surgery, you should get at least 2 letters of recommendation from surgery, and 1 or 2 letters of recommendation can be coming from subspecialty. Either it could be neurosurgery or it could be cardiothoracic surgery, it could be anything, but 2 letters of recommendation must come from the specialty of the choice. The one thing I would like to mention you that even I have seen some students in the recent weeks also requesting me to produce or to give them what you call letters of recommendation. It's good to take letters of recommendation from the dean, but I would prefer the physicians who are what you call, whom you are rotating in the clinical rotations, that play a lot of important role. So that's why I would request and I would suggest you to get good letters of recommendation while you are doing in the clinical rotations. So it's your job to do a good job in the clinical rotations to get good letters of recommendation. The other thing which will play an important role once this USMLE step 1 score is gone is MSPs. What do you mean by MSPs? MSPs is nothing but medical students performance evaluation or dean's letter, which will be providing at the end of the 4th year, during the 3rd year, while you are applying for what you call your residency. And I will be signing these MSPs. I will be reviewing these MSPs. Last year, we gave MSPs around 80 to 90 graduates who are applying for what you call residency. This year also, we have given around 80 to 90 MSPs. But I have observed repeated mistakes from the graduates, especially while preparing these MSPs. Why I'm saying that while preparing these MSPs, the graduates are doing mistakes? Because we give the information based on the information that you provided to the school, right? Because we cannot write MSP from scratch for each and every student. We have to prepare the MSP, but based on what? Based on your CV, based on your personal statement, based on your transcript, we prepare MSPs. But I have seen or I have observed some mistakes repeatedly done by the graduates. One of the other thing is what you call noteworthy characteristics. The graduates are required to mention noteworthy characteristics, maybe 3 or 4, but when they are writing these noteworthy characteristics, they are writing paragraphs and paragraphs. But I can tell you that what you call, nobody is going to read those paragraphs and paragraphs. Be specific and be what you call to the point. Suppose, for example, if you want to say that you are a team player, you can say that I'm a team player, but write what you call 1 or 2 statements about how you support that you are a team player. But don't write what you call the whole story of being a team player or whole paragraph. Then I don't think people will have that kind of time to read your paragraphs, especially the program directors and associate program directors. The other thing that I have observed is what you call the students are required to list their research publications also. When the students are listing their research publications, they're not following any referencing style. I think you should know what do you mean by referencing style, and we should know as a medical student, we should know what are the different referencing styles are available. AMA style or Vancouver style, Harvard style, or whatever you follow, APA style, but there are different referencing styles. You should follow that referencing style, because don't expect that what you call the clinical coordinators or the what you call executive administrator who are preparing these MSPs and reviewed by me, we are not going to correct these referencing styles. You are required to put your research publications in the correct format and uniform format. If you don't put these research publications in the correct format, then if I'm the program director, I think that what you call, you don't know the basic what you call concepts of research also. This is very important. Please focus on these things. And the other thing is, you need to mention your achievements also. Sometimes students forget about mentioning their achievements. And I have seen some students asking me what awards I have achieved while I'm in the basic science. How would I remember what awards the students have achieved? It's very important for you to keep up the track. You make a diary or you make an agenda of it. I think I have seen Dr. Ghani saying in his webinars that you need to write your what you call CV from the day one. You make your own CV from the day one with what you call all your achievements and important aspects of your medical school journey. That will be very helpful to you when you come to what you call writing MSP or public what you call giving information. The other thing is, I think they will be looking at even research experience also, but don't be too much focused on research experience. And nobody is expecting a medical student by the time of graduation. We are not expecting that you should publish like 7 or 8 articles. Even if you publish 2 or 3 articles, that will be enough. Another thing is, when you are what you call working on these research projects, please select research projects which are feasible for you and which you should be able to finish within the time period. If I'm taking up a research project for 1 or 2 years while I'm in the medical school, it will be too tough for me to focus on the medical school and also focus on the research project. Rather than taking up the projects which are like what you call 1 or 2 years, take a project which could be finished in 6 to 8 months. But if somebody is saying that I would be able to finish the project in what you call 2 weeks or 3 weeks, which is not feasible and it's not trustworthy. But you need to pick up a project which you can finish maybe 3 months or 6 months. And regarding the research experience, I would like to mention you that Avalon University School of Medicine has research electives. While you are doing the clinical rotations, you can choose any of the research elective available with Awesome. And we have one research elective available in California. This is for 8 weeks. You can do what you call research project with them. And not only that, you can publish what you call 1 or 2 papers with them. And that is one available. And there is one more research elective available in New Jersey also. You can pick up that project. And the other thing is, we are also providing a research elective for the students, especially if they are interested in medical education research. As a medical education unit in charge, we have seen tremendous what you call interest among the students to do the medical education elective. This year we already finished, at least I had like 20 students finishing medical education elective this year so far. And we have seen, what I would like to tell you is that, 3 key points regarding the research experience. You need to publish not more than 2 or 3 by the time you finish the graduation. And you can pick up the projects which are what you call 3 to 6 months. Don't go for long-term projects. And research electives are available. Multiple opportunities are available with Avalon. At least I can say 2-3 opportunities available, which you can pick up during your elective rotations. And the next link you can see on the slide. This is about what you call USMLE step 1 content and also specifications. You can go to this website and you can see what blueprint is there for USMLE step 1, what topics they are focusing on. This is very important for the students who are even in MD1. You should look at what you call what learning objectives you are required to achieve if you want to pass USMLE step 1. For that, you can go to this website and look at their content and outline. Definitely, it's very important for students from MD1. Next slide, please. If you have any questions at any point of time, you can ask me, no problem. And also, I have given 3 links here. One of them is the tutorial and practice test questions for USMLE step 1, which is available on the NVME website. And also USMLE step 1 sample test questions. Look at them. And when you look at the sample test questions, you will understand what kind of questions they are looking for on USMLE step 1. Not what you call step 1 process. It's at least a 2-step process or 3-step process. Most of the questions that you see on USMLE step 1, they're either 2-step process or at least 3-step process. Don't think that what you call they are going to give you straight or single sentence questions. They're asking 2-step process. Either physiology and pharmacology mixed, either physiology and pathology is mixed. So it's all integrated questions. You see, for example, in the past USMLE step 1 questions, like they give you a scenario or clinical VNAT, you need to diagnose the patient. You are done. But now, no, they don't stop at the diagnosis. They ask you what is your next step of management. That means they are looking at what you call management of the patient. And not only that, sometimes they can ask you what you call not only the investigation, sometimes they can ask you what you call treatment. That means they are bringing the pharmacology. So in a nutshell, all USMLE step 1 questions are mostly integrated. You don't see any single line questions. It's all about what you call 2-step process or 3-step process. So your thinking and your application process should work well if you are preparing for USMLE step 1. And also you can look at step 1 test question formats also available. So you can see that on the website, and practice sessions are available. If some students want to practice questions, these are also available on USMLE step 1. And another important thing is, previously what you call the USMLE is allowing at least 4 attempts on USMLE step 1 and step 2. No more what you call, sorry, they were allowing 6 attempts, not anymore. They are not allowing any more 6 attempts. They are allowing only 4 attempts. But I would like to tell you that if you fail on USMLE step 1 and step 2, it's very difficult for you to get into residency, because at least 50% of the programs will ask you to pass on USMLE step 1 and step 2 on first attempt. They are not looking for second attempt. If somebody fails on USMLE step 1 and you go for second attempt, there is less chance for you to what you call get into that kind of residency, at least 50% of the programs. But at the same time, If somebody fails on USMLE step 1 and step 2, it is not the end of the world. Please believe me, there are a lot of opportunities that are available. You always can come up, you can what you call cope up with whatever it happens. But our goal is to pass USMLE step 1 and step 2 on first attempt. But if some by bad luck or by unfortunate, and if you are not prepared well, and if you fail on USMLE step 1, but definitely it is not the end of the world. Next slide, please. And here, this is one of my favorite slides, all-time favorite slides. This is for what you call preparation for NVME examinations and also for USMLE step 1 preparation. Here, the preparation for USMLE step 1 or NVME, I always divide into 3 phases. Why I divide into 3 phases? Because we have 3 attempts of NVME. And I think most of our students understand this process of 3 attempts of NVME after MD5, because these students take what you call, our students take 3 attempts of NVME after MD5. The first attempt of NVME you are going to take 1 month after MD5. That means including 4 months of MD5, you have 5 months of preparation, because our MD5 is for 4 months, and 1 month after MD5, total 5 months. And second attempt of NVME, you will be taking 3 months after first attempt, and your third attempt of NVME will be 2 months after what you call your second attempt. And our objective is to what you call to pass on first attempt itself. But if somebody is not making on first attempt, they can go for second attempt. And if somebody is not making on second attempt, they can go for third attempt. But our goal is always to pass on the first attempt. And there are incidences where students are not able to pass even third attempt also. Then they are required to repeat MD5. That is the policy of the school. That is what you call remediation process. As per the remediation process, students are required to repeat MD5. But forget about repeating MD5. Our goal is to pass NVME on 3 attempts of NVME. And while you are preparing for first attempt of NVME, the resources are Kaplan, Petoma, First Aid, UWorld, and NVME self-assessments. And I'm not going to tell you that now you have to follow only Kaplan. If somebody wants to follow Boards and Beyond, you are free to follow. I'm not promoting just Kaplan, but I have no conflict of interest with what you call Kaplan. And but Kaplan is one of the best resources that I have seen. And during your 5 months, I have spoken to students regarding their NVME preparation for the last 2 years. I have spoken at least 150 to 200 students. This is one of my job responsibility, to speak with the students while they are in MD5, how they are preparing themselves for NVME exam. 3 common mistakes done by the students. One of the mistake is the most common mistake. While they are preparing for NVME, first attempt of NVME, they take Kaplan program. But while they are doing Kaplan program, they don't touch the books. They don't read at all. This is one of the common mistakes that I have seen. Some students, at least, or most of the students. The reason why you ask them why you are not reading while doing Kaplan program, they say that I attend class for 5 hours. After 5 hours of classes, I'm done with what you call, I'm tired. I don't have what you call energy to prepare for NVME examination. That is not true. You are attending Kaplan classes from 9:30 to 2:30. That is the class hours time, 5 hours. After 2:30, you can take 1 hour nap. Maybe you can go back to your room and you can sleep for 1 hour. You can still read. I would say 8 hours per day is minimum while you are preparing for Kaplan. And the same thing, you can see that the second phase and third phase also, I'm saying around 10 to 12 hours. But that, what you call, that is the optimal hours of preparation required for during your first attempt, second attempt, and third attempt of NVME. And the other mistake that I have seen with the students while they are preparing for first attempt of NVME is that I ask them, do you practice questions? Because this is one common problem that you encounter during basic sciences also. You read the information, but you don't practice the questions. Or some students I have seen that they practice questions, but they don't read the information. Both are wrong. You have to balance reading information and practicing application. You have to balance. What is the good balance? For me, good balance is 60% of your time going to reading and 40% of your time going to what you call, should be going into practicing questions. And do not wait for your second attempt of NVME or third attempt of NVME to practice questions. You start practicing questions from the day one. You read from what you call 2:30 or 3:30, you can start reading. By 7 o'clock or 8 o'clock, you get tired after reading of 5 hours. Then spend another 2-3 hours in practicing questions. At least you must practice 6,000 questions. Why I'm saying 6,000 questions? There are a lot of resources. 3,500 questions on UWorld and 2,500 questions on Kaplan QBank. They are the best resources for practicing questions. You must practice all those 6,000 questions. But some students I have seen using USMLE RX, Some students I have seen using Lecturio questions from Lecturio. Lecturio also has 2,500 questions, and all our basic science students have access to Lecturio because you are what you call, because you are enrolled in the basic science program, you have access to the Lecturio. Do the Lecturio questions also. USMLE RX questions and Lecturio questions, don't wait until MD5. You must be practicing USMLE RX and Lecturio questions from MD1 to MD4. But while you are in MD4, MD5, I would suggest UWorld and what you call Kaplan QBank questions you must be practicing. But do not wait for second attempt of NVMe or third attempt of NVMe to practice your questions. And third mistake that I have seen with the students is they don't take NVMe self-assessments. And I ask the students, why you are not taking NVMe self-assessment? They say that I would like to take NVMe self-assessment during my second attempt of NVMe, or maybe but during my third attempt of NVMe, so that I can I can preserve my NVMe self-assessment. It's too late. Our friends need to understand that is too late to take NVMe self-assessment. You must take NVMe self-assessment at least 1 month before your first attempt of NVMe. Why? Because when you take NVMe self-assessments, it will tell you what are your strengths and weaknesses. Based on your strengths and weaknesses, you can work on it, and you can change your study schedules, and you can change your study patterns. You can do anything that you want. That is very important. That's why I will tell you that you must do NVMe self-assessment at least 1 month before your first attempt of NVMe. And also, the other problem is that keep changing the resources. Don't change the resources. Don't keep changing the resources. I have seen students doing Kaplan during first attempt of NVMe, maybe what you call Boards and Beyond during second attempt of NVMe, some other DIT program for third attempt of NVMe. Don't keep changing your resources. Stick with one resource, master that resource. If you do multiple resources, you get confused. It's always better to one resource and stick with what you call one resource from day one till you take your USMLE step 1. So these are some of my suggestions. I'm not saying all these things just out of my mind. I'm saying out of these things, out of my experiences after speaking with hundreds of students. Please, next slide, please. And here, this is also my favorite slide, but I will give you one nutshell. While you are preparing for your second NVMe or your USMLE step 1, your entire preparation can be divided into 8 systems. You can see the 8 systems here: cardiovascular, respiratory, renal, GIT, endocrine and reproductive, central nervous system, musculoskeletal, and blood. These are the 8 systems. For these 8 systems, you should prepare pathology, physiology, and pharmacology like that. Suppose, for example, if you take cardiovascular system, I should prepare for physio, path, and pharmacology. Why I'm saying physio, path, and pharmacology is not a rocket science. Everybody knows that physio, path, and pharmacology are the 3 most important pieces for USMLE step 1 preparation. And if you look at the number of questions for pathology, there could be anywhere between 40 to 65% of questions come from pathology. Of course, that includes pathophysiology. 40 to 65% of questions of pathology also includes pathophysiology. And physiology questions can be anywhere between 20 to 27%, and pharmacology will be anywhere between 20 to 25%. So you need to focus on each system for physio, path, and pharmacology. Of course, in the recent times, they are gradually reducing the number of questions for pharmacology, and they are increasing more questions for professionalism, medical ethics, and communication skills and evidence-based medicine. They are focusing on those things. And as I said, what you call, even though they are reducing pharmacology questions, but still it has what you call 20 to 25%. And if you ask my suggestion, physio and pharmacology, I will take Kaplan. Blindly, I will follow the Kaplan for physio and pharmacology. When it comes to pathology, Pathoma is the best resource. Nobody can beat Pathoma. Pathoma is one of the best resources available for pathology. And like that, all these 8 systems, you should prepare physio, path, and pharmacology and practice the questions at the same time. You take UWorld questions, practice all CVS questions. You take what you call Kaplan QBank, practice all GIT questions. Like that, you should do. Suppose, for example, if I'm reading central nervous system, neuroscience and pharmacology, we should be able to use Kaplan, and pathology of central nervous system, you can go back to Pathoma. And not only these 8 systems, but you should also focus on microbiology, immunology, anatomy, behavioral science and epidemiology, biochemistry, and genetics. Each subject is important. They carry around 10 to 15% of the questions. I'm saying a minimum range and also maximum range of questions. For all these courses like microbiology, immunology, anatomy, behavioral science, and biochemistry, Kaplan is one of the best resources available. But one thing I would like to mention here, there is a lot of focus on evidence-based medicine nowadays, and including epidemiology and biostatistics. You can see at least 14 to 15 questions on epidemiology and biostatistics and evidence-based medicine, because the reason why they are focusing on evidence-based medicine, because they are expecting medical students should be able to critique, appraise, and read the literature, and should be able to implement those evidence-based medicine practices in your what you call clinical practice. That means we are expecting the students should be competent enough to be able to implement evidence-based medicine practice while they are involved in the patient care. That's the reason why there is so much focus on evidence-based medicine nowadays on USMLE Step 1. As I mentioned to you earlier, there are increased questions on communication skills, professionalism, medical ethics, and evidence-based medicine on USMLE Step 1. Next slide, please. So next one is USMLE Step 2 CK. But I don't say too much about Step 2 CK. While the students are in clinical rotations, there will be self-examinations at the end of each core rotation. So if you are preparing for your self-examination, you're automatically preparing for Step 2 CK. But one of the best resources available for Step 2 CK are UWorld, online med videos, Step Up to Medicine for internal medicine. For surgery, you can use Pestana. For case files for OBGYN, and you must use first aid and also NVME self-assessment even for Step 2 CK also. So this is going to be more important in the future, especially the students who are in the currently in the third year, first year, second year. There will be a lot of emphasis on USMLE Step 2 CK score. So we should be able to prepare well for USMLE Step 2 CK and should be able to do well on USMLE Step 2 CK. Try to find out what are the best resources available for each rotation. Suppose, for example, if I'm doing surgery rotation now, what is the best resource available, or what is the best textbook available? What are the what you call online resources available for surgery? Look at those things, prepare those things, and do well on shelf examination at the end of surgery rotation. If you do well on the self examination, suppose for example, if you do well on all the shelf examinations, definitely you will be doing well on USMLE Step 2 CK. And also you are required to take NVME comprehensive clinical examination also is required before you take Step 2 CK. So definitely, if you pass NVME comprehensive clinical science exam, you should be able to do well on Step 2 CK. So please focus on what you call preparing a shelf examination from the day one. And also for all our clinical rotations, they have students, they have access to online med videos. Please, those online med videos, suppose for example, if you are doing internal medicine rotation, they have videos. Online med have all the videos related to internal medicine. Beautiful class notes they have. Excellent videos they have made by excellent professors. You can use those resources while you are doing the clinical rotations. And we look at the data, how many students are using online med videos. For example, we have right now 135 students in the clinical rotations. Last month we looked at the data, how many clinical students are using these online med videos. Only 35 students are using it. That is what you call disheartening for us, because there are resources available for clinical students. It's all about students using it. You have enough time, you finish the rotation, you come back home, look at these resources available. Definitely you should do well during your clinical rotations on also on Step 2 CK. Please, next slide. And Step 2 CS, it's an interesting topic for all of us. The reason is Step 2 CS examination is a clinical skills examination, used to be conducted by USMLE and ECFMG, but no more they are conducting this exam. There is no more USMLE Step 2 CS. It is completely banned. It is not going to be conducted anywhere in the future. So then how ECFMG, Educational Commission for Foreign Medical Graduates, is assessing the students' clinical skills, and how, on what basis they are giving what you call ECFMG certification. Because they have given 6 pathways for that. But we don't need all those 6 pathways. We will be discussing about pathway 3 and pathway 6. Why? Because pathway 3 is a straightforward for Avalon graduates pathway 3. Because you are coming from an accredited medical school. Avalon is an accredited medical school by both ACCM and CAMHP. Because we are an accredited medical school, as long as school certifies the student, they have enough skills and competencies in clinical skills, they are okay with that. I'm doing that for clinical skills attestation for each and every graduate for us. The students are required to submit this application to the ECFMG. Then it comes for verification. Then our what you call executive administrator and myself will verify that student. And if that student have enough clinical skills and what you call competencies, we certify the students. On what basis we are certifying the students? If you do 3 core rotations with Avalon, and we look at your evaluations from the 3 core rotations, that is one criteria for us. Suppose, for example, if there is a transfer student, if he is not able to do all 3 core rotations by the time he is applying for certification, then we look at 3 mini CX forms. Mini CX forms means mini clinical examination. That clinical examination the student should do under the observation of a certified physician in the US or Avalon preceptor. We look at those 3 mini CX forms, especially faculty member of Avalon will monitor the student while doing these patient encounters. 3 mini CX, 3 patient encounters will be observed by 3 different preceptors or 3 faculty members of Avalon based on that. But of course, most of our students are direct students. They do 3 core rotations with us. We look at the core rotation evaluations and then we certify the student for clinical skills attestation. This is pathway 3 and it's very straightforward pathway, and our students have no problem. You're lucky enough because you are graduating from an accredited medical school. And pathway 6, for whom pathway 6 is for? This is for old graduates. There are graduates who graduated before 2018. They are not the recent graduates. For them, pathway 6 is important. Not only the graduates who are graduated before 2018, but there are some students who have failed on step 2 CS in the past. They have failed once or they have failed twice on step 2 CS in the past. Then they have to follow pathway 6. For pathway 6, they have to get what you call, they have to do 6 patient encounters. Who will be observing the students while they are doing 6 patient encounters? 3 physicians should observe. That means each physician can observe only 2 patient encounters. You cannot do more than 2 patient encounters with the same physician. So 3 physicians are required and each physician is supposed to observe 2 patient encounters, total 6 patient encounters. And then those 3 physicians will certify the student that student have enough clinical skills and competencies. These 3 physicians are nothing to do with Avalon. They have to find themselves. And these 3 physicians are required to be board certified in US. So this is pathway 6. One more time, I'm repeating, pathway 6 is only for graduates who graduated before 2018 and who have failed on step 2 CS at least once or twice. For them, they are required to follow pathway 6. But most of our students will fall under pathway 3 who are graduates after 2018 and they have no failure on step 2 CS. And for them it is very straightforward. We will look at their 3 core rotation evaluations. And if you have any questions regarding step 2 CS or ECFMG certification or clinical skills attestation, you are always welcome to contact me. Okay, next question please, next slide please. And here in this slide I'm mentioning what you call some of the data that we have collected from NLP Match. And this is the data that we have collected from 2020 NLP Match Data. What are the factors that play an important role when program directors select the students for residency interview? This is for an interview. They are selecting the candidates, they are selecting the applicants. What factors they look at? These factors are mentioned by the residency program directors. It's not mentioned by Avalon or it's not mentioned by me. This is mentioned by the program directors. This is what are the factors they look at. USMLE step 1 score is the number 1 and is the priority. And 90% of the program directors mention that USMLE step 1 score play an important role while selecting the candidate for an interview. And the letters of recommendation in the specialty, as I mentioned to you already, letters of recommendation play an important role. 2 letters of recommendation from the specialty of choice and 1 letters of recommendation can come from subspecialty. And then our next important factor is USMLE step 2 CK score. Yes, we know this. Step 1 score is not going to play an important role in the future. USMLE step 1 score will disappear from this list in the next coming years. And then USMLE step 2 CK score will play an important role. Step 2 score will play an important role in selecting the candidate for an interview. And the personal statement, yes, personal statement also is very important for selecting a candidate for an interview, but be specific in the personal statement. What they are looking in the personal statement, why do you want to become a doctor? Why you have chosen this specialty? And why have chosen this program? Be specific. You don't need to go into the controversial topics or you don't need to what you call preach the program directors or something like that. Stick with what you call the point, what you would like to say about the personal statement. Why you want to become a doctor? Why you have chosen this specialty or why you have chosen this program. Those are the important things that you need to mention in the personal statement. Too long personal statement, they may not have time to read for that. And then MSP is, as I mentioned to you, MSP is nothing but medical student performance evaluation is given by the deans, is called Dean's Letter. It is prepared by clinical coordinators and executive administrator, and I will be reviewing the letter at the end, and I will be signing off these letters. And as I already mentioned at the beginning of this topic itself, there are some mistakes that I have seen or I observed with MSPs. Please be focused while you are giving information to the school, and be focused on your noteworthy characters, research publications, and your achievements during medical school. Maintain diary and agenda from the day one of your medical school to write proper MSPs and personal statements. Okay, these are the factors. They look at what you call top 10 important factors while selecting a candidate for an interview. Next slide, please. Okay, you have been selected for an interview. You did an interview. You did an excellent interview, or maybe you did very bad interview. But what happens to you while the program is selecting what you call residency applicants? They look at different things. You can see your interpersonal skills. This is the ultimate goal for a physician, you know, professionalism and communication and interpersonal skills. This is the most important thing that the program directors or even the evaluators look at while selecting the candidates for the matching process or for the residency position. And interactions with faculty during interview and visit. This is very important, how you interact with the faculty members of the residency program. Interactions with the house staff during interview and visit, not only for faculty members, not only the program directors and associate program, how you behave with what you call janitors, how you behave with somebody you see in the corridor. All these things play an important role in assessing the what you call a residency program for the residency programs. No residence program director would like to have what you call a problematic resident. You might be very good. You might have what you call 265 on your USMLE step 1 and 245 on step 2 CK. But your communication skills, and if you are not a team player, and if you don't go well with the other residents, and if you don't go well with the faculty members and medical students and peers, nobody will be interested, because nobody wants to have an headache in the program. And definitely letters of recommendation also play an important role. So these are the 5 factors. So step 1 score, step 2 CK score, they play an important role for selecting an interview. But once you did the interview, it's all about your communication skills and interpersonal skills. They play an important role. Okay, the next slide. Next slide, please. Yeah, so this is the topic for today actually. So the next 20 minutes of my time will be focused on virtual residency interviews. What is this virtual residency interviews? And I think all of you know that the world is going through the tough and trying times. And these are definitely unprecedented times for all of us. It's not only for you, not only for the medical students, not only for the applicants who are applying for residency programs. It's also tough time for even the program directors also. They're breaking their heads how to select the what you call candidates, appropriate candidates for residency programs. So they are conducting this what you call virtual residency interviews. And these virtual residency interviews, definitely they will be conducting these virtual interviews this year. I'm sure next year also they will conduct virtual interviews. But don't be surprised. Many of the residence program directors are thinking of doing virtual residency interviews forever. The reason is it's so much advantage for the what you call applicants, especially for the students who are just graduating from medical school. You don't need to travel for an interview. You don't need to go to the residency program, or you don't need to go to the hospital. You are saving a lot of money on it. And not only this is very important, because every residency applicant for the traveling and for attending interviews, they spend around what you call $8,000 to $10,000. Definitely that's a lot of money for a fresh graduate. You can save, but there are some advantages and disadvantages also with what you call virtual interviews. But definitely for coming years, for next, I would say 3 to 5 years, there is a possibility that all residency interviews will be virtual. But if it is forever, don't be surprised. So what should be done by the applicants to prepare well for the virtual residency interviews? And this is one of the documents. You can see the link over here. Is released by AAMC, American Association of Medical Colleges. They come up with few points for what you call guiding the residency applicants, not only for the residency applicants, even for the medical school applicants also. They come up with what you call this guide. And this is very beautiful document. If you have time, especially for the what you call the graduates who are applying for residency for this year, please look at this document. and go through the document, and you can see what are the different tips. Definitely, I'm going to go through all those tips, but it is also important for you to look at that document. And they have divided these questions, the questions that they can ask for virtual residency interviews, into 3 categories. Of course, these 3 categories, even for the in-person interviews also, these 3 categories will be there. The first one is behavioral questions. What do you mean by behavioral questions? Behavioral questions means I'm looking at whatever the students learn or the medical students learn by the behavioral learning theory. That means you repeatedly practice those skills and competencies. Either it could be a physical examination skill, or it could be a communication skill, or it could be what you call any other skill, patient interviewing skill, or maybe any skill they can look at. But how do I know the residency program is looking at particular competence or skill? You know that ACGME core competencies, they have medical knowledge, patient care, communication and interpersonal skills, professionalism, practice-based learning, and system-based learning. These are the 6 core competencies for people who are entering into the residency. So you can look at those competencies, or look at the residency program website. They have specifically mentioned what you call what competencies or skills they are looking at, and gather that information and reflect those skills and competencies on your CV, because you already have written your CV, you already written your MSPE, you already written your what you call personal statement. So look at that skill and competency, and what is your experience related to that skill or competency. Reflect those experiences, bring back those experience during your interview. Maybe they ask you a question about what you call patient interviewing. Maybe you might have some experience regarding the patient interview. Bring that experience during the interview and explain how you did well the patient interview and how you excel that patient interview. So these are called behavioral questions, linking your experiences with the skills and competencies what the residency programs are looking at. The next slide, please. The other type of questions they can ask is general questions. These general questions can be for any interview. Describe yourself, tell me about your native place, and why did you choose this specialty, why you are interested in internal medicine, why you are interested in family medicine. And you know, I did one mock interview for one of our graduates recently. 2 days back, I did a mock interview, and I asked him why you are interested in family medicine. The way he explained why he's interested in family medicine is beautiful. So these are the questions that you need to prepare. And they can ask you not only why you are interested in family medicine, but they can ask you why you are interested in this hospital, why you are interested in this program. These kind of questions, we call them as general questions. These questions can be asked during the residency interviews. And the next type of question is definitely situational questions. What do you mean by situational questions? They can give you a scenario or a situation, and they ask and they seek your response. What kind of response you are giving? These are called situational questions. And I will give you one example. Maybe you are working on a case, and you and your colleague worked on that project, and you presented to your attending physician, but the attending physician give you the whole credit. He didn't give any credit for your colleague. How would you respond in that situation? These are called what you call situational questions. Why? Because situational question is very important, in my opinion, in interprofessional education or any healthcare education or for any healthcare profession. Situational assessment and situational awareness is very important. And it comes with situational monitoring. You might be working in inpatient setting, you might be working what you call ambulatory setting, or you might be working in emergency care. No matter what, but you need to assess your surroundings. That what you will call it as situation monitoring. Based on that, you assess it, and based on that, you work with other what you call other colleagues and other team members. This is what we call situational questions. They also can play an important role in the residency selection process. Next slide, please. And here, I would like to give you one simple slide, and what information I should gather apart from this question and answer. You should gather whether the program directors are conducting live interview or asynchronous interview. Sometimes some of the programs are conducting live interviews, but some of the programs are conducting asynchronous interviews. What do you mean by asynchronous interviews? Here, what the programs will do is they will send a set of questions to the candidate, and they will ask the candidate to answer those questions. And the candidate is required to record those what you call those answers, and then they will send the videos to the program back. Some programs are doing asynchronous interviews. Don't be surprised. Why asynchronous interview? Simply they can conduct the live interviews. Yes, definitely live interviews are more convenient for the candidate and also for the programs. But some of the programs are they're looking at what you call, maybe because of lack of resources or maybe lack of what you call things. Some of the programs that I know, they are doing asynchronous interviews also. And look at what kind of video interview platform they are using, the programs are using. Maybe some programs might be using Zoom, some programs might be using WebEx, or maybe GoToMeeting. So look at what program they're using. Most of the programs are using Zoom, but some of the programs are also using WebEx due to security reasons. They're also using WebEx. And also seek the information for the program. How many interviewers will be there? They will give you that information. Don't think that the programs will not give me the information if I am asking how many interviewers will be there. Sometimes the programs itself themselves will provide how many interviewers will be there. And look at how much interview length. Is it 30 minutes or 45 minutes? Like those things you need to look at. And types of interview questions, what kind of questions they are looking at. You can go online. There will be lots of resources where you can get different, what you call, examples of interview questions. The 10 to 15 standard questions. Look at those questions and prepare them. And prepare yourself. Do yourself. And what you call, prepare in front of the mirror and practice all those questions. Not only practicing in front of the mirror, recently we started helping our own students and graduates with the mock interviews. Please, if anybody wants to do mock interview with us, please don't hesitate. Please contact us. You can contact either Dr. Gani, who is our Associate Dean of Postgraduate Education, or you can contact Dr. Wilson, who is our Dean of Clinical Science, or you can contact me also. We are open to do the mock interviews. And I received what you call one email from one of the students who did the mock interview today, and he said the mock interview helped me a lot. So I request all the graduates or even the residency applicants who are applying for this year, if you have a chance and if you are interested in doing mock interview, please contact Dr. Gani or Dr. Wilson or me, any one of us. We are very happy to help you with that mock interview process. And the other thing is, look at your competencies and skills, what the interviews, what the residency programs are looking at. This one I already mentioned to you. So the program directors are looking at certain competencies or skills and relate your experiences to those competencies and skills. Please prepare for that. Next slide. Here, what you call some of the suggestions that I would like to give you, some of the suggestions from the next few slides. But most of these suggestions you already might know about it. As I already told you that what you call, if the programs are looking for certain skills and competencies, reflect from your CV, personal statement, and MSP. Use those experiences to explain your competencies and skills, what the programs are looking for. Next slide, please. And these are some technical suggestions. This is very important. Stable internet connection, a computer or tablet, but don't use the cell phone for doing an interview. Definitely you should use either computer or tablet, a stable internet. This stable internet, again, I will relate to my experience. During one of my mock interview I did with one of the student, he has very, what you call, difficult internet connection. It is what you call, there are so many times, what you call, there was interruption to the internet. I suggested him, go for what you call a good internet connection where you can get stable internet connection while you are doing this interview. Next slide, please. So stable internet connection, a computer or tablet rather than a cell phone. And double check your microphone, it is working, and camera should be working. So camera should be placed at the appropriate place so that they can see you properly. Because do not show only your forehead or eyes. They are supposed to see your entire face. But if you're showing only your forehead or some part of your head, they think that what you call, you are not confident enough. Do not try to be an introvert. Even sometimes, there are options while you are doing these interviews on online. There are options where you can chat with the what you call interviewers. But don't engage too much in chatting. Chatting whenever it is required, you can do 1 or 2 questions you can answer. If the interviewer is asking question through chatting, you can answer, but don't engage too much in chatting. But if you are engaged too much in chatting, they think that you are not able to speak up or your communication skills are not good. And also have backup plan all the time. It's very important to have a backup plan, especially while you're doing these virtual residency interviews. And have your tablet or laptop, whatever it is, it should be fully charged. The next one, next slide, please. And always go for a private place, a quiet place. Do not choose a library to do a residency interview, or don't do it in a coffee shop. And avoid sources of bright light. And I have seen some people using bright light while doing what you call online interviews. Never use the bright light. Your background should be very clean and neat. And don't use too dark backgrounds. Go with what you call lighter background. And do not directly focus the light on your face, so that it will be very difficult for them to see you. So use appropriate background, and don't use the virtual backgrounds also. I have seen some interviewers using virtual backgrounds. Virtual backgrounds, for me, it doesn't look professional, or it doesn't look nice. So don't go for virtual backgrounds. Use clean, neat, and what you call white background or cream color background, whatever what you call the background which is light colored, you can use it. The next slide, please. And dress professionally. This, I know you guys all know about it. While you are doing a residency interviews, definitely you need to dress professionally and position the camera at the right place. Okay, so these are the things that you need to do. Anyhow, all of you are aware of it, but I don't think anybody will be going unprofessional dress. Definitely, you should have professionally dressed, and the camera should be appropriate place, and they should be able to see you fully. The next slide. And this is what you call the summary, what we have discussed so far. It's a nice slide to put together. The first one is what you call, all the programs are looking for certain competencies and skills. While they are looking at skills and competencies, gather that information, as I mentioned earlier, what skills and competencies are they looking for, and relate to your experiences. It could be a clinical experience or non-clinical experience. But don't give too many examples for same skill. For example, if I'm talking about what you call physical examination, the skills related to physical examination, you can give one example. You can give two examples, but don't give 10 examples for physical examination. Then it will be too, what you call, not clear for the interviewers. Go with one or two examples related to that skill. That is one thing. The second, what you call key home message, is that what you call, use clinical experiences, and also you can use non-clinical experience. Suppose, for example, if I'm talking about communication skill and competency, you can give one clinical experience, but you can also give one non-clinical experience. It's interesting for the people who are listening to you. So don't restrict yourself only to the clinical experience. You can also give non-clinical. Something happened outside in the community, you can give that. Something happened during your basic sciences, which is related to your communication skills, or maybe your team player, or your role as a team player, you can give that example. And the next one is, do not provide any patient name in any of the experiences that you are mentioning. You are not supposed to give any patient information or any patient name while you are giving. You can say that what you call, a patient, something like that, but you cannot give any personal information related to the patient. And the last but not the least is, do not speak anything negative about your colleagues or whatever happened in the past, or do not speak anything negative about any other residency program. So I did interview with one of the program, this is what happened there, and I didn't like it. Do not say anything negative about any other residency programs, or do not say anything negative about your colleagues or peers. These are the four key points related to what you call virtual residency interviews. Next slide, please. Okay, so here I have mentioned some of the resources that is very useful for what you call virtual interviews. Anybody who is applying for virtual residency interview this year, you can use these links. The first link that is coming from Journal of Graduate Medical Education. This is a specific journal for graduate medical education in the US. And they have mentioned some do's and don'ts while doing the virtual interviews. Very clean article, very nice article, very simple, specific, and to the point. Look at that article once and see what do's and don'ts, what they have mentioned. They come up with what you call these do's and don'ts after what you call listening to so many people. This is from Journal of Graduate Medical Education. Please look at it. And also Journal of Graduate Medical Education, they released what you call 20-minute audio about what you call virtual residency interviews. That is the second link. I listened to this audio also for 20 minutes. It's also very beautifully done, what you call, you can say that podcast. It's a beautifully done podcast regarding virtual residency interviews. Please listen to it once, and you will have what you call very nice and wonderful ideas from them, what you call, after listening to this audio. And the last but not the least slide, this is what you call coming from Society of Directors of Research in Medical Education. And these are the directors of medical education across the medical schools in the US. And they formed a consortium. This is a consortium of directors of research in medical education. They do what you call Twitter discussion on every Thursday at 9 o'clock. And their Twitter discussion is called Meta Ed Chat. They have discussed about these virtual residency interviews. The entire transcript of that Twitter discussion, I mentioned the link here. If anybody has patience and they have time, especially people who are applying for residency, they have given all the resources. You name it, whatever the resources, not only for the residency applicants, even for the residency program directors and interviewers, including them, they have given all the resources. So whatever the different resources, how to avoid bias, for the residency program directors, how to what you call avoid bias for the what you call interviews. They have given all the resources. But at least people who are applying for residency program this year and next year, look at all these what you call resources available. Definitely, it will be helpful to you. And thank you so much for everyone. Thank you so much, Dr. Amin, and also thank you so much for all the participants for your time and patiently listening to me for the last 1 hour. And now it's time for questions. If you have any questions, please type and send your questions. I'm open to answer your questions.
Can you repeat the transfer student how to determine the eligibility for the CS qualification?
Same thing. For transfer students also, the Avalon University School of Medicine require 48 weeks of rotations. During that minimum, that is the minimum requirement of 48 weeks of core rotations are required. During that 48 weeks, they will be doing 3 core rotations with us. As long as they do 3 core rotations with us, we look at their what you call core rotation evaluations, and based on that, we certify them for clinical skills attestation. We call it as clinical skills eligibility or attestation. We do that. But in some cases, if any transfer students don't do 3 core rotations, they are required to do 3 mini CX forms, that is mini clinical examination. They will be doing these what you call 3 mini CX examinations with 3 faculty members of Avalon or 3 preceptors of Avalon. Faculty members in the sense clinical faculty, not the basic science faculty, clinical faculty they should do. Under the supervision of this clinical faculty, they will be doing 3 patient encounters, and these 3 physicians will be certifying them. And after seeing that 3 mini CX forms, we will certify them for step what you call this clinical skills attestation or eligibility. But I just would like to answer another thing also at this point of time. And there are certain requirements for ECFMG, for giving ECFMG certification. Those requirements are passing step 1, passing step 2, passing OET exam. OET exam means occupational English test. That is generally conducted for all the healthcare professionals, but now it is also required for ECFMG, OET test, and eligibility certificate from us for clinical skills. We should certify, the school should certify the student for clinical skills, and also diploma and transcript from Avalon. So these are the requirements for ECFMG certification. So that's how we certify the students, transfer students, 3 core rotation evaluations. Even for our original students also the same thing, 3 core rotation evaluations.
Thank you, Dr. Arja. The next question is, do we need to do OSCE still for the clinical skills?
Yes, is required. OSCE is not requirement for what you call is not a requirement for ECFMG. It's not a requirement for clinical skills attestation. We don't look at OSCE because I have seen this question from some of the students. I have passed OSCE. Can you certify me for clinical skills attestation? No, we don't certify the students based on clinical skills for clinical skills based on OSCE. We certify the students for clinical skills based on 3 core rotation evaluations and or 3 mini CX forms. But is OSCE still required? Yes, it's required for graduation. If you want to graduate from Avalon, one of the graduation requirements for Avalon is passing OSCE exam. And OSCE exams are conducted by Zimidus. They are situated in Florida, and we are outsourced this OSCE examination with Zimidus. And you can take OSCE exam any day of the year. And if somebody would like to, what you call, student would like to take my OSCE exam in the next week, they can do it. And it is available 365 days with what you call except holidays. It's available with Zimidus. But only one requirement to take OSCE exam is you must complete all your core rotations. Without completing core rotations, we don't allow the students to take OSCE examination or step 2 CK. Even for step 2 CK also, student must finish all co-rotations.
Thank you. Where and how we can get the presentation, PDF presentation for of today's presentation?
Yes, I think that Amina, I think it's there on our website where they can find these residency webinars archives. They can go to these archives and then they can find out all the what you call video links over there.
Of
I think
course.
webinar archives is there, right? That I mean,
Yes,
is there.
that's right. And just to add with that information, Dr. Arja, that this webinar also being recorded, and the recording will be available within a week along with this PDF of this presentation. So you can download the PDF also from there.
Yeah, sure. Thank you.
And the next question is, could you please talk about post-interview communication, postcard versus email? What would you prefer if you were a PD?
Yes, definitely. You know, it is. I would do both, but maybe just in case, I would do both because email is what you call the immediate communication. Definitely, I will send the thank you letter through the email, and I will also do the postcard also. I will do both.
Okay. What is
Especially if the program is allowing postcards. Yes, definitely we should be able to do it.
okay. What is the best way to address an interview question on how I have dealt with conflict in the past?
Conflict with yes, it's good to what you call be open and transparent, but at the same time you should present that in a what you call positive way. That's what I prefer, because it's as I said, it's always good to be open and frank, but at the same time it should be what you call done in a proper way, not like straightforward and frank. Too much openness sometimes it can backfire us also. That's why it's always important to present that conflict of whatever the conflict that the student is referring to should be present in a nicer way rather than what you call in another way.
Okay.
See, for example, I have seen these students asking questions. For example, I have seen the students asking, what if I don't take my what you call maybe I fail on USMLE step 1? How should I address that? Yes, definitely you should address it, and you should address it in a manner that they should understand it. And I have seen students asking me this question. Even for example, students have taken leave of absence after MD5. This is one of the common problems that we are encountering nowadays. And some students are asking for leave of absence. They are taking too much leave of absence. They should be able to be ready for answering that question in a right manner. And at the same time, it should be frank and open and truthful, not in a manner that it should not affect you or it should not backfire you. You should be able to explain in a manner where they should be able to understand it. And maybe if you have family reasons, you should be able to explain it. If you have health reasons, you should be able to explain it. But we don't encourage a long-term leave of absence or what you call for a long period of time. It's always better to be active and to be in the curriculum, to be in the active academic period. These are the common questions the residency program directors can ask. If you have any failures on USMLE examinations, if you have taken a long period of what you call leave of absence, or maybe if you have failed on basic science course, or your score on a basic science course is less. For example, you just got what you call C grade on one of the basic science course. Maybe they might ask you, maybe you might have not scored well on one of the clinical rotations, or maybe they might have seen negative comments on one of your clinical rotations. These are some common questions which are awkward and which you may face difficulty, but you should be able to explain it a proper way where they should be able to understand your pain, and they should be able to understand in a way that they come into your shoes. You should make sure that they understand your problems. That's the only suggestion I can give you.
Thank you, Dr. Arja. Some program requires an LOR from the dean or department chair. How do
Yes.
we get one?
Yes, this is very important question. These are the most important question and the most important what you call things that I face on a regular basis as a dean. See, I have received one what you call student sent me an email last week, and he asked me to give him a letter of recommendation. I gave him letter of recommendation, and because the program is requesting, or maybe he's looking for a letter from the dean, and he wrote me back very nice what you call thank you letter for me. It actually made my day. So definitely as a dean, we are very forward, and we are we are ready to help our students. That is one thing we can do. The other thing is the other letter, some of the programs, especially internal medicine. The thing is associated with internal medicine residency. They are asking for a letter from the chair of the department. For this case, the student should request our clinical department. I always suggest the clinical coordinator to talk to the internal medicine chair, and even I take the help from Dr. Wilson. We speak with the clinical coordinators, and we contact the chair, and the chair will look at your evaluation from internal medicine, for example, and then they will sign the form, or they will give you the letter of recommendation. Most of the work will be done by the central clinical department, and we will send it for the review of the chair of the department, then they will get it done. So this is what happens. This is mainly for, I have seen with the internal medicine and family medicine, they're asking for internal medicine rotation evaluation from the chair of the department. So we are ready to help. And the only problem here is the chair of the department of Avalon may not know the student, but he would like to see the evaluation of the student. Who can provide the evaluation of the student is because we are receiving the evaluation of the student from internal medicine rotation as the central clinical department. And we will give that evaluation to the chair. Based on that, he will write the letter of recommendation, or he will sign the form. This is one thing. And I would like to answer one more question also along with this question. This is the question for the students who are applying for residency in the New York. And our Avalon graduates match into New York residency every year. Every year we have like 3-4 graduates matching into the residency programs in every year. It all depends on the individual program directors, and it will depend on the individual programs. But when they submit this application for them, one of the requirement for them, the New York residency programs, is that every rotation should be attested. Who should attest this rotation for New York residency programs? Either the director of medical education from the hospital where you have done the rotation, or the chair of the department from the hospital. They should sign that form. This also we are helping our students. And the students should contact the clinical department, and I will be oversighting all those requests. I will be having an overview of all those requests, and we will have communication with other deans also. And then we will try to help the student appropriately. Suppose, for example, if a student apply for residency program in New York, his internal medicine should be attested by, for example, the student have done what you call internal medicine in what you call Raleigh General Hospital in Beckley. For example, I'm just giving you an example. That internal medicine rotation form should be attested by the director of medical education at Raleigh General Hospital, or it should be attested by the internal medicine chair at Raleigh General Hospital. This is how we are helping the students who are applying for residency programs in New York. We have received this kind of requests from New York for some of our students. I think I have seen 2 or 3 requests in the last year, and I have seen 2 or 3 requests in this year. This is how we try to help. But at the same time, I can tell you that a lot of times we have we always, Avalon is one of the best school I have ever seen in communication with the students, especially when you send an email to the clinical department or executive administrator, or even for what you call our deans, associate dean of postgraduate education or dean of clinical science, you get response within 24 to 48 hours. Even if you send me an email, you will get a response from us within 20 to 48 business hours. We are ready to help, but you also should understand, the graduates also, or even the students should understand that you should be able to give enough time. Don't rush for the things in the last minute. Have a plan for everything. If you are submitting MSP October 1st, you should plan for it in July or August for MSP, because we have hundreds of graduates for whom we have to prepare MSP. Always you think in that way, give advance time for the people who are working on it. Even for these things also, if you want a letter from the chair of the department, if you want a letter for applying for what you call applying for residence in New York, we are willing to help. We are open to help. Let's work together and give enough time for the people who are working on it. We should achieve these results.
Thank you. Is it going to be a problem to get into residency if a student from 3 different medical schools?
It's not about what you call 3 different medical school. Is it a problem for entering into residency? It's not a problem for entering into residency. Definitely the program directors will ask the student why you have transferred 2 medical schools. Is there an issue with that? They will ask that question, and if the student is able to answer that, Yes, you are fine. You should be absolutely fine. Give reasonable reasons. Suppose, for example, if somebody is what you call transferring from a non-accredited medical school to accredited medical school, Avalon, you can say that I transfer from a non-accredited medical school to accredited medical school. It's a reasonable reason to transfer a medical school, and definitely everybody will understand that. But don't say that I transferred because of ECFM certification or something like that. Then it doesn't. If you transfer for educational reasons, everybody will like it. If you transfer because of curricular reasons, if you are transferring for teaching methods, everybody will like it. Suppose, for example, if you say that because I transfer from a big medical school to school like what you call Avalon because their tuition fee is very affordable and feasible for me, it's a good reason to transfer, because we don't want to have too much tuition burden on the students. It's definitely they will accept it. These are the reasons. Are some I have seen some students saying that what you call, with my old school I have to wait for my rotation for 1 month, 1.5 month I have to wait for my rotation. But with Avalon, back to back rotations, and there is no downtime, so that's why I transfer to Avalon. It's a good reason to give. So these are the reasons that you can mention, if they're asking why you transfer from sort of 3 medical schools or 2 medical schools. But the only problem with the ECFMG, but now ECFMG is saying that you cannot transfer more than 1 medical school. If you transfer for more than 1 medical school, your credits will not be accepted. So suppose, for example, if a student is transferring from a medical school A to B, they can accept the transcript, what you call, of A. But if you're transferring from B to C, then your credits from school B will not be acceptable, because that's a second transfer. That's what happens with what you call multiple medical school transfer. But once you are already ECFM certified, once you already taken USMLE step 1, step 2, and you are ready for ECFM certification, it won't be a problem. But in future, if somebody is applying for USMLE exams, USMLE step 1, ECFMG is not accepting more than 1 transfer. That's the only thing. But if it is coming to the residency programs, give valid reason, reasonable reason. Everybody will understand it.
Thank you, Dr. Arja. Who should we contact for more information regarding the research electives?
Yes, research elective. Yes, you can contact the clinical coordinators. We have Melissa and Jackie, and they are wonderful people. And you can contact them. They will immediately give you 3 options. We have 3 options right now. As I mentioned to you, one from California, one from New Jersey. And beautiful thing is, all 3 of them are online. You don't need to be on campus. All 3 electives, and it's all webinars. It's all reading materials, assignments, writing assignments. So you don't need to go there. So you can contact our clinical department. Because of clinical coordinators only, we received this year 20 students in medical education elective, medical education research, because they promoted our elective so much, so well. You can contact the clinical coordinators for that.
Thank you. Could you please shed some more importance on step 3 for the selection, Dr. Arja?
Yes, step 3, I think, suppose, for example, step 3 may not be that what you call important, especially for students who are coming from, if they are US and Canadian citizens. But if the students are coming, if the what you call students or graduates have citizenship from India or Nigeria or any outside North America, I mean, what I want to say is outside international graduates. Because we in Avalon also we have a lot of students outside US and Canada. For them, passing step 3 before applying for residency is important. For me, in my opinion, it's important, because without step 3 they won't sponsor H1 visa. If you are looking specifically for H1 visa, definitely you should pass step 3 and you should what you call go for it. And but for H1B or what you call H1 visa, you need step 3. Passing step 3 is required. But not only for the visa purposes. Suppose, for example, even if I'm an American student, or even if I'm coming from North America, or even if I'm coming from an international country, whatever the international country, I applied for residency this year. I was not able to match, but I was waiting for something, and I was waiting for the next year. Yes, definitely, you have enough time to pass step 3. Take step 3. Definitely, it will be an advantage for you, because you already passed step 3. Because residency programs require passing step 3 by the end of first year or by the beginning of second year. Suppose, for example, they require it. But if this graduate is already past step 3, I don't have a headache. If I'm the program director and if the student apply for residency, this student already passed step 3. I don't have that extra headache that this student should be able to pass step 3 during first year. You don't have that. So that's why I will say that passing step 3 is always advantage. Specifically for international students, for the H1 visa purposes, it's important. But for even for North American students also, if you are waiting for your residency, why don't you do it? Do the step 3 and pass the step 3. If you are waiting for residency for next year, I would suggest 3 things. What I should do for the 1 year if I didn't get match for this year. Prepare for your step 3, or involve in research activities, or do additional electives. You can do additional electives. So you can do all these 3 things, whatever you like. Pass step 3, definitely it's an advantage.
Thank you. I would like to know about the 12-week rule for newer programs and what impact it may have on licensing.
Yes, as per the 12-week rule is that one of the important for license is 12-week rule. As per the 12-week rule, any medical school which is not approved by New York State Board, you cannot do more than 12 weeks of rotations in New York. You can do rotations in New York, but it must be under 12 weeks. That is one of the requirement. So you cannot do more than 12 weeks. That is the requirement for what you call licensor, or even for residency also. That's why I said earlier, when you are applying for residency in New York, one thing that they would like to look at is you should not do more than 12 weeks in New York, maximum. Even for Avalon also, we don't allow you to do more than 12 weeks outside our rotations. We have rotations in Chicago, West Virginia, and Phoenix. Anyhow, we don't allow more than 12 weeks. Preferably, those 12 weeks must be electives. So if you want to do rotations in New York, not more than 12 weeks of electives.
Okay.
So that is very important. That is one requirement. And another requirement, as I mentioned to you before, for residency, not for licensure, for residency, that every of your rotation must be attested by the director of medical education or the chair of the department.
Thank you. Please explain how to send a thank you letter to an interviewer if we only have an email of the coordinator. Isn't it awkward during the interview to ask the interviewer for the email in
I
order
think
to send
whatever
you
you
a
send
thank
to
you
the coordinator, it will be passed on to the program director and associate program directors. I don't think you can address to the program director and associate program director to the what you call to the coordinator. You can address everyone actually. You can ask to pass on that thank you for everyone. That's my opinion.
Thank you. Around what time frame should we expect majority of the interview invitations?
I think they already start what you call giving a residency interview, what you call invitations. I spoke with a couple of the people who applied. There is some of them received what you call 5 interviews, some received 7, 8, some of them. I heard one student received already 20 interviews. So they already started receiving interviews. Maybe till the end of November they will be doing it. But I doubt if you get more invitations during December and January. It is tough. Maybe you may get few invitations in December. January it's almost nil. By the beginning of January there won't be much invitations. Till the end of November you will be getting it. And when I spoke with the students also, they are saying that what you call, and I think this is the common thing. What they do is they will try to contact the programs and program coordinators every week. They will send one email or maybe a phone call, but don't disturb them too much also at the same time. Maybe once in a week is fine to ask them, did they, because the thing is, this is one of the what you call student told me, the way he explained to me is perfect. What he explained to me, see, if they read my application and if they don't give me the invitation for an interview, that is absolutely fine with me. But if they don't even look at my application, then I feel bad. It's touched my heart actually. So that is exactly what is true. When you submit your application for residency, at least they should look at your application. And after that, they give you interview, or if they don't give you interview, that is secondary. But if to make them to look at your application, sometimes what should we do is we should be calling them once in a week, or maybe we should be sending them a reminder emails if they get a chance to look at our what you call our application.
Thank you. What is the best time to send the letter of intent for programs to express your top program?
I'm sorry.
What is the best time to send the letter of intent for programs to express your top program?
Once you're done with the interview, you can send your letter of interest to them. That's how you express your interest.
Okay, thank you,
Right?
Dr. Arja. Yes.
Yeah. Any other questions, Dr. Amin?
Yeah, we have like few more, like 3-4 more questions, Dr.
Yeah,
Arja. I
sure.
will
Go
go
ahead.
them one by one.
If you're okay and if everybody's okay, we can go ahead with the questions. No problem for me.
Okay. Is there anyone in school faculty that can reach out and advocate on behalf of students to program directors or residency programs?
Very good question. If we know somebody, definitely we would like to help the students. And there are, and I think it's all about grabbing the opportunities. That's what I look at. And slowly, our name of Avalon is going into the residency programs. They are recognizing us. Is not only that, even when we are writing our MSPs, also in the first paragraph itself, we are mentioning that we are one of the few medical schools in the Caribbean which are accredited by both ACCM and CAMHP. And for all the MSPs, the first paragraph itself, we are mentioning that. And we are trying to make a market or make an impression for Avalon across the residency programs. And I can tell you the one thing, one of the residency program director from Alabama, associate program, he want to visit Avalon in January. He's coming in January. So these kind of opportunities you should grab. And not only me, if any of the faculty members or if any of the other deans come across the program directors or associate program directors interested in Avalon and Avalon students, we are always welcome to advocate them to about our Avalon and also our graduates and students. And this is a great opportunity for our basic science students. The first session from the associate program director will be in January, between January 10th and 13th. Just I would like to let you guys know that maybe we can have one session with him even for third year and fourth year students also, like a webinar.
Thank you, Dr. Arja. And it seems this is the last question of this today's webinar. Can we do additional elective rotations if we have graduated?
Yes, you can do it. We are open for it. And some of the students I suggested in the past to do additional activities, and some of them have did it. And I can give you multiple examples for that, and they're doing additional electives. It's always useful for you guys if you do additional electives.
Thank you, Dr. Raja. So that was the last one. Now, if you have any closing remarks to make before we close the webinar.
No, I'm good. Thank you so much, Dr. Amin. And I think it's a wonderful platform for all us to communicate with our students. And you made this what you call presentation very wonderful, and without any glitches, we were able to conduct. Thank you so much for that. And also, I would like to thank faculty members, deans, and students for attending this what you call webinar. And thank you for your time, and definitely thank you so much for listening to me. Thank you, guys. I wish you all the best for the residency applicants this year. I wish you all the best. If you need any help, do not hesitate to contact us. Thank you so much.
Thank you for your kind words, and thank you for joining us tonight, and we wish you the best and restful evening. Good night.